by contrast to the MENA region, the Nordic countries largely have established HTA and reimbursement decision-making bodies. So Danish Medicines Council, the SBU and TLV in Sweden. However, one of the very few key challenges highlighted within the Nordic region is that despite their kind of established frameworks, access to innovative treatments can be somewhat hindered by the largely inflexible value slash pharma economic assessments in place that evaluate new and innovative treatments, and balancing this with any decision making around what is more increasingly expensive treatments with ensuring access for rare disease patients to these treatments that is of course delivered in a financially stable way to the healthcare systems. So, you know, in terms of sustainable affordability, that's not just a problem specific to the Nordics, but also a problem globally. However, the funding infrastructure within the Nordic region can pose a few challenges, notably in the countries where there is a decentralization of funding for healthcare. So, for example, Norway, funding for rare diseases has shifted to the hospitals, whilst in Sweden, funding can be regional depending on the route selected for assessment, as I mentioned, outpatient versus inpatient. So this decentralization can often result in a sort of fragmentation in the pathway between final pricing and reimbursement decision making that occurs and the time to access for patients as the regions and localities work essentially to accommodate costs associated with reimbursement and of course implementing access to a new drug.